Hey everyone, so today I'm back with another mock USMLE question. This is going to be question number 26. So you have a 55-year-old female with past medical history of type 2 diabetes, mellitus, and asthma who comes to the clinic for a rash in her abdomen, and I'll show the rash in a second. Patient reports the rash started suddenly about 2 days ago. It's associated with significant pruritus, but denies presence of any constitutional symptoms, with no fevers and chills. Patient denies any associated pain with the rash. Otherwise, temperature is 37.2, blood pressure 156/94, and pulse is 86 beats a minute. On physical examination, an ovoid rash is present on her abdomen, figure 1, and here's the rash. Feel free to pause here if you need more time to look at the rash. So once again, on physical examination, an ovoid rash is present on the abdomen, no other rashes elsewhere on the body are noted. What is the mechanism of action for the drug that may be used for the treatment of this rash? The options are irreversibly inhibit study S subunit on the ribosome, neuraminidase inhibitor, inhibitor prokaryotic topoisomerase 2 and 4, or inhibitor of 14-alpha demethylase. If you need more time, go ahead and pause the question here. Here's the rash once again. So the correct answer is going to be inhibitor of 14-alpha demethylase. So to answer this question, first you have to know what exactly is this rash that you're looking at. So this is the rash of tinea. In this situation, I told you this rash was located in the abdomen, so this would be tinea corporis, which is once again a superficial fungal infection. And how do you treat superficial fungal infections? You treat with topical antifungals. And one thing I'll point out looking at this rash briefly is that, remember with the rash of the tinea rashes with these superficial fungal infections, they're typically a round or ovoid shaped rash which have a central clearing. So that's what we see for this patient. And often the edges are raised. So this is very high yield. Please memorize this rash in memory. This is the rash for tinea infections. Now look at the options. How do we know option D is the correct answer? Well, let's go through option by option. The first option is irreversibly inhibits 30S subunit on the ribosome. That's the answer. That's aminoglycosides. You're not going to treat a fungal infection with aminoglycosides, so that's why it's incorrect. Option B is a neuraminidase inhibitor. That's incorrect because neuraminidase inhibitor, that's essentially Tamiflu or Stalmavir, so that's good for viral infections. Option C is inhibitor prokaryotic topoisomerase 2 and 4. That's the mechanism of action for fluoroquinolones, which is once again not going to be the preferred treatment for fungal infections. And then option D is going to be inhibitor of 14-alpha demethylase. That's the mechanism of action for all the azole medications like fluconazole and clotrimazole, along with all the different azoles. So that's the correct answer because the treatment for these superficial fungal infections, tinea corporis, is going to be topical antifungals. And it's also important to remember that for most tinnias, especially if you don't see signs of extensive disease, you're able to treat these infections with just topical antifungals. Now, if a patient does have signs of extensive significant disease, then in that situation, or if the patient is refractory to topical treatment, then you can use oral antifungals. But for most patients, you can just treat with topical antifungals. And that's going to be it for today.